Hello and a warm welcome to all our healthcare professionals tuning into this episode of MedAI series, where we dive into the convergence of AI in healthcare. I'm Hetvi Shah, your host for today's session, and our topic is one of immense significance today, which is AI in healthcare. And we have an exceptional panel from Doctors AI to help us decode this exciting field. So, first, let me introduce to our first guest today, Dr. S.V. Kulkarni, a leading figure in internal medicine and an advocate for AI integration into clinical practice. Dr. Kulkarni's work is optimi- works Dr. Kulkarni's work in optimizing patient care with AI has set a standard in medical community. So welcome, doctor, and it is a pleasure for have you
Thank you.
here. Next, we have Dr. Shelly Sharma, a renowned radiologist whose expertise in utilizing AI for advanced imaging is transforming diagnostic accuracy and patient outcomes. So, welcome, Dr. Shelly, and it is a pleasure to have you.
Thank you.
Also, also with us, we have Dr. Atul Tiwari, a pathologist specializing in applying AI for more precise pathology interpretation, enhancing the way we diagnose complex conditions. So, welcome, Dr. Atul, and it is a pleasure to have you with us.
Thank you.
Next, we have Major Dr. Ashlesha Tavde Kelkar, a public health expert who is here to discuss how AI is driving innovations in public health management and disease prevention. So, welcome, Dr. Ashlesha. It is a pleasure to have you.
Thank you.
Lastly, we have Dr. Amit Kumar De, a diabetologist and a visionary AI entrepreneur. Dr. Amit's insights into the future of AI in medicine will guide us through today's discussion. So, welcome, Dr. Amit.
Thank you very much, Hitvi. Warm welcome to everyone at the 27th episode of the MedAI podcast. It's been over a year. We've been hosting this fortnight podcast series. We've had visionary leaders and speakers from across the globe here in this podcast platform sharing their views. And today's episode is a very, very special episode, especially for me because I've got a few important people who are very close to me, who are working hand in hand with me in our Doctors AI community. Dr. Kulkarni, Atul, Dr. Ashlesha, and Dr. Shelley are the wing leaders of our Doctors AI community, each from their individual specialty. So, in today's podcast, over the next 1 hour, we're going to be diving into some of the specialities in the field of uh, healthcare. Especially, we will be looking at internal medicine, we'll be looking at some viewpoints in the field of medical education, and we will also look at public health, radiology, and pathology as a subspecialty through our discussions. So, dear friends, some of you who are our regular viewers at the podcast, you must be aware that these subspecialties we have not yet covered. So, I thought today's episode could be a perfect blend of bringing the experiences from these fields and the voices from our Doctors AI community. So, folks, a warm welcome to all four of you to our Med AI podcast. So, what I'm going to do is I'm going to take question to each one of you in the first round, and we'll take a viewpoint from each one of you from from a topic pertaining to your specialty. And I'll start with our uh, most learned person, a person who's been a guiding light, a patron of the Doctors AI community, Dr. S.V. Kulkarni. So, my question to you, Dr. Kulkarni, is you have seen the technology world and the healthcare world evolve over the last 3 decades. You've seen the evolution of 2G to 5G, and today we are in a space where we are looking at artificial intelligence, generative AI, large language models, uh, probably general artificial intelligence very soon, which is going to be impacting healthcare. First, a viewpoint from you. How has this journey been so far? And how do you really see this transformation happening in the next 5 to 10 years, especially in the field of internal or general medicine per se?
Thank you. Thank you, Amit. And thank you all the panelists who have joined. Thank you, MedSynapse, for creating such a wonderful platform. Friends, I go back to 1974. You know, majority of might not have been born at that time. And when we started our medical career in the first MBBS, I still remember the smelly dissection room and the big library and the stacks and then the staircase to go about and get the things done. Then I take a gap for about 24 years and I recollect my first American College of Physician conference. There, what I saw that on your smartphone, you can locate each other. Suppose if you are in a big convention center like say San Diego, the distance between the 2 points may be around 2.5 kilometers. But we were in a position to locate each other. You know, that was very exciting for me. In the latest ACP, I saw an unusual delegate. That delegate was a robo, and that robo had a scar of herpes on his face. And he was telling everybody that how horrible the pain of herpes is and why you should be protected. Means from a dot, I have seen to a man. Like go back to 2002, it was a Maharashtra Association of Physicians conference, which was a out of the state and state of the outside the state conference. In the sense, it was a conference of Maharashtra physician, but it was taken in Goa. And Goa, you know, 2002, what a paradise for everything. That time, I had a small gadget. It was called as a PDA, Personal Digital Assistant, and you can take the name Tungsten Tick. It had a stylus. And
Right.
I could manage all my delegates, all my accommodation, all my faculties there just with the stylus, and everybody was looking towards me as if I'm a magician to get the things done. It was very difficult for me to convince the physician community, especially all the seniors who were more than, say, 10, 15, 20 years senior to me, that there is something, a tsunami is going to come by the name of technology, by the name of artificial intelligence, and we Indians are not ready for it. Even though majority of the work of artificial intelligence, incidentally, my granddaughter used to stay in Fremont, California, near the Tesla factory. And Sunnyvale and everything, all these places, they are the birthplaces of all the AI things. I used to go across Meta while going to the airport, you have to cross Meta. Majority of the work of AI is done by Indians, and Indians are not
True.
using it. So I requested, I can take name also, Dr. Sandhya Kamath, who was the president of API in one of the Kolkata APCon. And see, we were not that advanced at that time. We had just only some medical calculators to show and how to calculate EGFR and BMI easily. Otherwise, if you recall, previously we used to calculate the BMI with the height on one side, the weight on other side, then we used to join a line and that used to give us BMI. So I requested मैडम को, मतलब पाव पकड़ के बोला कि मैडम मुझे 1 घंटा दे दो. I want to conduct one workshop on smartphone. She said that what nonsense, smartphone. What is the use of smartphone in clinical medicine? Okay, and Amit, that there was one auditorium. That was a theater-like auditorium. And initially I thought there will be 5-10 people maximum, because I had a team of 5 people in that workshop. And you will not believe that whole hall was full. People were standing back to the wall also. And all my students, and one of the students who became my co-faculty later on, Sagar Sinha, all the seniors were behind them to teach them how to use the calculators, how to download Medscape, how to download QX calculator. And since then, Amit, I am very happy and confident that since that time, 2009, I have never looked back.
Fantastic.
I have been called as an ambassador of technology in clinical medicine in India. They labeled me for anything. Aslesha may recall, Alok always calls me as Bhishma Pitama. I had to check whether how many arrows are there on my back. creating awareness and making the people to adopt. The two big things which happened. One was launch of ChatGPT.
So true.
Before that, I was involved in evaluating so many medical softwares and the electronic health records. Again, see the rift. I will not say it is the rift between the, but there is no synergy between the technical side and the medical side. I wanted in my vitals, neck circumference, arm circumference, wrist circumference, waist, calf, and hip circumference. The EHR was not ready to give it to say, though, sir, uska cost badega. You know, I don't think that is a nonsense answer. Whether I had 10 columns or whether I had 1,000 columns, the cost remains the same. Then came ChatGPT, and then came one of my very favorite publication, NEJM AI. Before that, there was Lancet Digital. Before that, there was the Journal of Journal of Internal Medicine, which is Amit is one of the co-editor and the valuer and reviewer. We used to pick up articles from that. I used to read it in the journal clubs in my medical college. And Amit, I will tell you, Aslesha, it was a very good part on our side that we conducted a program in MGM Medical College about awareness.
So true.
So it is a journey from one medical college to another medical college. One medical college, I was a student. Here, I was a professor. I have seen in Czechoslovakia the anatomist, the table, and I'm very happy that anatomist is going to come to my medical college also. So we are no way behind others. Only thing that we need to create awareness, take action, motivate people. Motivation is important, and what Dr. CI is doing is a phenomenal thing. Amit, I really congratulate you on this step of creating awareness, making involved people involving, and these three positions, pathology, community medicine, and radiology coming together on one stage. As far as the future in internal medicine, it is unimaginable. I can have 24 cogwheels of clinical medicine, and in every cogwheel, there is AI, which is going to ease the thing. But the question asked by few of my people, I don't call them now as juniors, they are but juniors to me by senior by age, but junior to me by AI, that is it going to kill the creativity of my students? I
Mhm.
know it is not possible. On the contrary, it is going to augment it, and that augmentation is the real AI of AI what we are talking today. Amit, I stop here because there are other participants who want to also share. But in between, whenever a time comes, you can be you can ask me any questions, and I will be there with you. Thank you very
Yes, but you laid the foundation. You laid the foundation to the introduction of the whole context of our discussion today. And I always keep telling you that you were ahead of your time, but you're still very much on your time now. So now today, what the vision that you shared about 20, 30 years back, those things are happening at a very, very fast rate. And and you're one of the pioneer leaders who are helping people adopt to this change, to this technology and learn it in the right way. Like you said, we had a fantastic primer at the MGM Medical College hosted by Dr. Ashlesha there. Fantastic viewpoints there from Dr. Kulkarni. I'll now move on to Dr. Ashlesha. Ashlesha is a public health expert. She's working as a professor in the MGM Medical College in Mumbai. So, Ashlesha, we've seen challenging times during the COVID days. And we really hoped we had artificial intelligence then, having some kind of disease surveillance, predictive algorithms that might have helped us tackle COVID in a better way than we did. But standing today with so much of machine learning models around us, generative AI around us, and you yourself have been part of artificial intelligence projects, and you know some of your colleagues who are working. So, how can public health be transformed using AI standing today? And do you see a space of using the latest AI technologies like generative AI in disease surveillance? And if, touch wood, if we are to face a pandemic or an epidemic situation? can AI come to the rescue?
Thank you, Amit, for that wonderful question and this opportunity where, like Dr. Kulkarni sir just mentioned, a very unique combination of community medicine, pathology, radiology, along with internal medicine, and how AI is really being one of the, now one of the most important tool um, to go ahead and times to come. So when it comes to disease surveillance, yes, you mentioned it, very pertinent mention, that is COVID-19. We all saw various models coming up during COVID, first wave, second wave, but then none of the models, the disease models, really worked and could predict how the disease would progress, or what kind of outcome we will get. The primary reason for that was very limited involvement of clinicians or clinical side in making or developing these models. While that was the case, later, after the disease outbreak, or after the pandemic was over, we all realized, to a certain extent, we came to terms with digital health, not yet AI. Right. So digital health and utilization, or use cases of digital health. And much before that, I must mention that the government of India had already taken steps looking at or seeing where the artificial intelligence is going, or the developments in information and technology. We had already started with the infrastructure in artificial intelligence, and recently we came out with some of the very commendable initiatives, and one of the most important ones, which is not really talked a lot because it is very specific to, let's say, disease surveillances, is IDSP, integrated disease surveillance program, or
Right.
portal. So this IDSP has been running since a very long time. We have been having diseases which are under surveillance always. But then, with the advancement in AI and overall digitalization with better infrastructure, this integrated disease surveillance portal has seen a sea change. Now, if we go to this portal by IDSP, you will see week to week disease surveillance or disease outbreak reports. Real time, you can actually see the reports of each and every district in India, with how many cases, what kind of action was taken, what stage the disease is. And that kind of real-time data is being made available with the help of artificial intelligence. And of course, not just artificial intelligence becomes, it sits on the shoulders of giant, which is, first the um, electronic health records, and things like Ayushman Bharat. So now that's again another thing. Ayushman Bharat health infrastructure, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, and to mention and cannot go without is Ayushman Bharat Digital Mission. So these are some of the pioneering things which have come up recently, which are helping for disease surveillance, and IDSP, or Integrated Disease Surveillance Portal, which actually works along with ISRO. So we get real-time information. We actually, can GIS map these disease outbreaks, and there are various, applications to these kind of outputs that or inputs that we receive. Of course, not to mention telemedicine, remote health, it has always helped. But during telemedicine, what we realized was India is a diverse country. We have many languages, many cultures. So where AI came in play, the languages of the doctors on sitting in one window and the patient sitting in some other state, which of some other language. So that language barrier, accessibility barrier, AI can definitely help and has been helping with Bhashini and some other really critical, applications where it can be translated, the languages, especially the local, regional Indian languages can be translated from one to other and can be, understood. So that is another thing. And of course, the third would be, predictive analysis with, like Sir mentioned, Google or even of course, there are many other. So predictive analysis, for predictive analysis, we have had now, um, see, the data has to be good, strong, robust. And where else do we get that kind of data but in India? And uh, of course, we don't have that quality of data, but the amount or the quantity, we have that number. That is the strength that we have. So we have good collaborations. Even the government has good collaborations with these good tech giants, and they come up with better and better predictive models for analyzing. And we see for each, if we go disease specific, we will see tuberculosis or even neglected tropical diseases like leprosy are under surveillance with the help of AI. So there is a lot to be, done, but a lot is being done right now in public health space with the help of AI, and especially, the accessibility or let's say resource limited setting, that needed the, that needed to be um, addressed, and AI is helping it in a in a big way.
So I think there's a huge potential of public health being transformed, especially in India. And I think ABDM will probably be the first step. It will be the cornerstone in bringing this transformation. And I know that you're working very closely with the Ayushman Digital Bharat Mission project, and I'm sure we will be looking at much more updates coming from this domain, especially in India. Yes, we might be having shortage of quality data. We might be having uh, less good quality structured data, which might give a good amount of inference. But I think that's just a temporary step limiting factor or maybe a temporary setback. And as we evolve, especially with the literacy around us in our Doctors AI community, I think it is just a matter of time that this will be really changing the way we look at public health problems. So I think as you are very right, and this is a space that will evolve faster than many other space, I personally believe. And
Yes.
thank you for the updates on some of the projects which are going on across the country. So from public health, we'll move on to the opposite spectrum, the other spectrum of the application of AI, that is radiology. And this is a space, folks, where we've seen a maximum application of artificial intelligence. This is a domain which has evolved with artificial intelligence. I'm sure Dr. Shelley would say that yes, there has been a good change of roles of radiologists in these days with the use of artificial intelligence. So let's hear it from you, Dr. Shelley. The first point, the first thing that you tell us is, how has it changed? How has artificial intelligence changed things for a radiologist? Where are we placed in the in this whole spectrum of using AI, validated tools, getting them evaluated, putting them into clinical application? Where are we placed, and where are we heading in the domain of radiology?
So, Amit, can you hear me?
Yes, we can hear
Am
you.
I audible? Yeah.
Yes,
Okay.
please.
Thank you. Thank you for the opportunity. And thank you to Dr. Vedya, sir, for giving such a nice introduction. And I was really very impressed by the work he's doing. So if AI had a favorite child in healthcare, I think it would be radiology.
Very
Most
true.
of the focus has been in radiology space, a lot of focus actually. Many
Mhm.
people are working in it, and there are, you know, multiple aspects of radiology which have been taken care of by AI, starting from, appointment of the patients to workflow optimization in radiology space, and then of course the main reporting where the radiologist's role um, can be taken over by AI, as some people feel that, there was a few years back, there was someone had given this statement that don't pick up radiology as a specialty, because it no longer is going to be a specialty and it would be taken over by AI. So yeah, there is a lot which is happening, and we actually have a very limited, I would say, there is a limited. I mean, in India, because of the PACS integration and the software integration with the AI systems, there is not much which is there with the radiologist. Actually, you cannot play with too many AI tools. It depends on the service provider who's providing you the machines. Like for Siemens, for example, Siemens has certain AI solutions which are inbuilt and which are really great. I mean, there are tools which helps the radiologist in uh, sectioning or segmentation of particular organs. For example, liver volume detection or liver volume uh, calculation in cases of patients who are donors or patients who are recipients. It used to be very time consuming for a radiologist to do it. And now with the help of AI, it can be done much easier, much easily, more accurately and faster. And there are certain tools in space of breast imaging which are available, which help in detection of breast cancer, early detection of breast cancer, and they help the radiologist in picking it up. There have been studies where AI has acted as a second reader in screening mammograms and helped in earlier detection of breast cancer. Apart from that, there are tools which have come in which are yet to be tried. They are mostly related to decreasing the time of MRI scanners. The scan time can be reduced, almost up to 50%. I'm yet to try those. I'm aware that there are such tools which are available, but yet to try those. So yes, there is a lot happening in the space of radiology. There are also tools which are available for detection of diseases on chest X-rays, such as Cure AI, which is quite famous in India. And there was a pilot project which they did in Chennai, where they were able to pick up many more cases of tuberculosis on chest X-ray. So it can be helpful in public health space where, especially in peripheral areas where there is, lack of radiologists. So in those areas, it can be really helpful to work with such tools.
Yeah. So deep learning, I think, has been a well-established section of artificial intelligence and using the combination of neural networks in the deep learning models. I think radiology has seen a lot of developments, but whether these developments are good to put to in practical use is something which doctors like Shelley is going to vouch on, and that's where their validation and their evaluation comes from the medical community and fraternity. So one thing we understand from what you said, Dr. Shelley, is that the screening part can be done very well using the deep learning models. Whether artificial intelligence is going to bring more precision into radiology or maybe into interventional part of radiology is something which you folks might want to see with the evolution that is happening in the space.
It can definitely help us in triaging of patients.
Sure.
We can
Yes.
triage based on, yeah, as you rightly said, it can be a very good screening tool.
Mm.
And it can triage the patients that these are normal and these are abnormal, and the abnormal can be further, second read by the radiologist. And also, definitely, it has cut short the time of radiologists by doing, mundane tasks such as
Yes.
tumor volume calculation or volume calculation of the particular organs. So all that can be easily taken care of by AI. But to say that AI is going to replace radiologists is very far-fetched,
Mm.
Yeah.
All right. So uh, let's move on to another specialty. Dr. Kulkarni, I'll come back to you after this. Let's move on to another specialty and let's go to Atul. Besides being a pathologist, Atul is also a hardcore coder, and he spends a lot of his time doing a lot of coding work and developing projects, building them. So, so he is in true sense bilingual. He speaks both the technical as well as the medical jargon full-fledged. So, Atul, tell us what's happening in the space of pathology. We know that digital pathology is coming in a big, big way. How is that going to transform with a layer of artificial intelligence and probably give you a more precision pathology in the days to come? What's the update, Atul?
Yeah, thank you, sir, for this question. Basically, to answer your question, I might share a journey of digital pathology from not so digital to AI lingo using those sort of things. So, as opposite to the radiology, both of the branches are using images. But since radiology is using computer since beginning, they are more prone to be adapted towards digitalization as well as using AI or any sort of algorithm. But for pathology, there is more human tasks are involved before going to digital, like processing the tissue, then making the slide. And because of this huge limitation and cost to digitalize the slide, we were very restricted towards creating any sort of algorithm or even thinking about it, because any single slide costs around 15 GB of space, and earlier it was very troublesome to even host 100 slides on the cloud. But now, with the recent advances, there are so many changes. Just to give a brief idea, like in case of digital image analysis, earlier, like 10 years ago, when I was starting about it, reading about it in 2016, the most fascinating things were like quantifying mitosis activity and quantifying Ki-67 activity in slides using some digital algorithm. For that, the famous software was Fiji, F-I-Z-I. It is still a very famous software for image analysis. And another one was QUPath. So those sort of things were there. And if someone knows those things, it is like he is masters in some digital path. Because even doing those things were taking so much of time. It used to require programming knowledge also to quantify those sort of things. And pathologists used to think like, if we learned all those sort of things, it is easier for us to manually count the mitotic activity under the microscope itself. But later on, when the algorithms take over, then it became very easy. Now we have ready-made code. We don't need to code also. And even in the digital analysis, no, we don't just need AI for these sort of things. But when AI came into picture, the things even got more interesting. Like now we can see patterns which human eyes were not able to see under the 40x of my microscope or even the oil immersion. So now we can see some nuclear patterns which are not understandable using plain HND staining slides. We used to do special stains, or we used to do ISC just to confirm some diagnosis. Now AI is picking up some patterns in those HND stain slides using some ground truth, and that is making it better. Yes, in India, we have a limitation of good quality data that is digitalized, because, as I mentioned earlier, that we don't have that infrastructure. Like we don't have whole slide scanners in most of the very well established institutes also. They didn't even realize that why do we need this scanner we had that in earlier, then we could have made some very beautiful algorithm in-house. Right now, we are dependent on the work that is done by the international community. There are some very well funded and startups, like one of which is AI for AI. Another one is Pays AI. There are many more. Patch AI is another one. So these are FDA. These are using FDA approved algorithm for detection of breast cancers, for prostate cancer detection, and even lung cancer, colorectal cancer. So now they have got the FDA approved algorithm. So if they have got that approval, it means they are as equally good as trained pathologists could be. In India, we have done some. I have read or seen some good work by in case of hematology. One of them machine made by Mindray and one is by Siktuple. They are picking up the rare human poikilocytes or the blood cells. So that is a good approach to detect diseases early. So that is my point of view.
So I think you have made a very, very important point there, and I'm really happy that you said that there is a space where by using digital pathology and by getting a more higher resolution image, putting a layer of AI on it, we could probably be seeing newer patterns which could completely give rise to a newer way of diagnosing a pathological condition. And I think that is revolutionary. That is revolutionary. You could find newer markers, you could find newer changes in a cell that could help you diagnose a disease quicker or better. It could probably, maybe the textbooks of pathology will have to be rewritten
Yeah.
with the algorithms in space. So I
Yes.
think this is very important point which you are making, and I think it's going to be a space that we all need to watch out for as it evolves. But I agree that digital pathology should be there, whether AI or not. Digital pathology should be there in every setup, and it is very much the need of the hour. But again, rhetorical question to this: if you have a lot of digitalization, does your colleagues feel threatened that the basic screenings, identifications would mostly be done by the AI, and pathologists would be merely turned into histopathologists?
Most of the colleagues, yes, they are threatened. Not only pathology colleagues, even other branches colleagues. They ask me, why do I code, or why do I even contribute to these type of innovations? And yes, it is a double-edged sword. So it's like I would always say, doctors without the knowledge of AI might get replaced by the doctors who use AI. So AI assist doctors who are getting assistance from AI, they might replace. But it's not like that AI can replace each and every doctor or each and every pathologist. In the end, there will be a pathologist sitting behind the desk. Earlier it was
Yes.
microscope, now it might be laptop. He might be seeing a digital slide on his iPad also. But
Right.
anyway, yes, in that case, guidelines need to be strict. So this thing, I think government should be incorporated, or they should hear from the perspective of doctors. Like, if we don't have a clear cut guideline, then or if someone misuses it, then there can be potential negative impact might also be there. For example, even we are at a drawback of like approving any CBC report which is not signed by a pathologist, and most of the
So
clinician
you
also
have
know.
NABL guidelines and regulations which
Yeah.
actually govern, even in clinical setups which govern that. But I think at the moment it's in a nascent phase,
Yeah.
which needs to be more put into research with an open mind, with an innovative mindset of inviting the research of AI in pathology and explore new patterns that could kind of change the way we define a particular pathological condition. I think that is something that needs to be looked at. Maybe in 10 years down the line, you will be sitting there and writing those guidelines and regulations down the line. So now what I'm going to do is we're going to go back to round two, and I'm going to go back to Dr. Kulkarni, but I'm going to ask him a question on a different context. But he had raised his hand earlier and he wanted to make a comment on something related to Dr. Shelley's comment. So we'll let you take that comment, Dr. Kulkarni.
Yes, thank you, Amit. I got comments for both, by both my third eyes.
Yes.
Radiology is a third eye of a clinician, and pathology also is a third eye of a clinician to look into deep into the tissues. Actually, there have been lot many papers, especially from the Chinese side, where they have analyzed almost lakhs of X-rays, and they are diagnosed even diabetes by the way in which the shoulder fat looks under that LLM or that machine learning protocol. Also, there has been something called as a nodule assessment. If you have got a single nodule in the chest, it's a dilemma for everybody because it can be from anything, from anything. So, are there any algorithms which are applicable and available in India where you can at least predict a possibility of diabetes from a chest X-ray, or you can help getting analysis of that solitary pulmonary nodules to either be malignant or a hematoma? That
Sir, uh, sorry, I'm not aware of diagnosis of diabetes from chest X-ray, but as Dr. Atul was also saying, there are when we feed these data into these convoluted neural networks, it comes up with various permutations and combinations. And recently, there was an article where from the voice, it could detect if I think it was for hypertension or something. Dr. Amit, are
Parkinson.
you aware?
It was Parkinsonism.
Okay,
You can
so
Yeah, it was Parkinsonism.
yeah, okay.
Yeah.
So it's basically based on that. I'm not aware of any such paper from India where it is able to diagnose diabetes from chest X-ray. But yes, I'm aware of multiple softwares which are available for diagnosis of for making out whether a solitary pulmonary nodule is benign or malignant based on its characteristics, that how it appears. One of the companies is Cure AI, as we were talking about, which is working in field of diagnosing various diseases on chest X-rays, and it has almost 99% sensitivity in picking up everything from TB to cancer, lung
Yeah.
cancer.
So this is a very important point which Dr. Kulkarni has raised, and to both Dr. Shelley and Dr. Atul, there is going to be more and more of an attempt of trying to diagnose or predict outcomes. I would rather say diagnose disease based on certain patterns out of images, like an X-ray or anything. From the medical viewpoint, we also have to understand that we always do not need diagnosis out of a pattern. We need to understand that which particular pattern might be the most useful in answering that need gap. So that is where, the medical experience and the expertise also comes in. Like Dr. Kulkarni said, trying to diagnose diabetes out of a chest X-ray. Is it the best way, or would you be able to diagnose out of any other pattern? So, or maybe I would say trying to diagnose, the other day we were discussing about trying to diagnose um, COPD and bronchial asthma from voices. Would you really be wanting to do that, or would you want to look at breath sounds and take up a predictive algorithm out of the breath sound? So this is also very important that we lay the foundation, what should be used in which kind of
What?
predictions.
Yes,
Yes,
absolutely.
not
And
just because,
also,
yeah, yeah,
sorry,
please go ahead.
and also a data which, like sir said, it's coming out of Chinese journals, not
Yeah,
necessary that this data, that kind of algorithm would work with Indian subset of population
very true,
and will
very
be able to predict diabetes as it is doing in the Chinese population.
very
And
true,
you're
because the
absolutely right.
yeah,
Do we actually need it? Is it the need of the hour to, look at
correct,
chest X-ray and be
correct,
able to tell that this is
very
diabetes?
true. Working on the diverse data set is something which is very important, and this is where the Doctors AI community comes in with their voices, with the requirements, placing the need gap before the solution. I think what is happening at the moment is the solution is ahead of the need gap. The solution is coming, create a vacuum and fill the vacuum like a need gap, but it should be the other way around. The need gap should be calling in for a solution. So now let's go on to the next round of questions to each one of you. I'll come to Dr. Kulkarni with his question, and he's been a professor training in medical institutes. And this is something that I was telling in my primer the other day in Ahmedabad, that artificial intelligence is going to be one thing that is going to change the way we learn, we teach, and we perceive medicine. How do you see that this is going to be transforming medical education in the way it is taught and it is being learned? A quick snapshot, Dr.
Yes,
Kulkarni.
it's absolutely going to be a total different ball game. Previously, we had only one professor of anatomy from whom we are supposed to learn for 1.5 years. Now there is a choice for the students. The education can be done individualized. There are some slow learners, there are some fast learners, there are some medium learners. There are certain people who are good in mathematics, there are certain people who are good in drawing, there are certain people who are good in synthesizing the answers. So we have to find out, we have to find, AI going to help you to identify the weakest link. It has been said that the chain of a strength of a chain lies in its weakest link. So with AI, in the whole spectrum of education, right from understanding to accumulation of the knowledge, reproducing, teaching, like do one, teach one, and adopt one. It is AI which is going to be a non-fatigable entity. If you
Absolutely.
ask me one question 10 times, I'm going to be irritated. But AI is not going to be fatigable. So this is the biggest advantage. Not going to take any leaves, no vacation of Diwali or no vacations of summer. Aslesha is smiling because we stay in the same medical institute and we enjoy these kind of educations. So it is going to be a continuous process. This process is going to be, it is not only learning, it is going to be first unlearning for the teachers, relearning for them, and then establish that relearning so that you can teach to the students. And it is a phenomenal change which is going to happen over the next 4 5 years, and you will see the results very soon. Thank you.
Just to add to it, it is going to make learning more personalized. I
Yes.
think this is what the learning module systems of the day of today's generation is going to have, that when you will be learning virtual through a virtual platform that involves a learning module system, the pace at which we learn a particular topic, a particular chapter will be varying individually. So something that I'm very slow in picking up, with an AI guidance, I might be able to give in more time, have a more structured understanding of it, a more detailed breakdown of it, and a topic which is much easy for me to understand and consume. Probably I can take it up in a rush.
Okay. I mean,
It is
just
also very,
kind of
yeah,
one point. It is not only going to be personalized, it is going to be precise.
precise, absolutely
And
very precise.
secondly, you can imagine the introduction of haptics in medical education. If
Yeah,
you look at cholesterol molecule like this or a insulin molecule like this, after turning, what happens after changing the molecule, how it happens, you can see everything in 3D.
very true.
Not possible. That 3D interpretation and 3D evaluation was not possible previously. Just wear a headgear and you are into the world.
That's where our virtual reality and augmented reality tools comes in, AR and VR comes in, and that is also going to be another space that is going to transform medical education. And the last part, which I really feel, and maybe I'm feeling a little, I'm thinking ahead of time, is it's always been about memorizing a greater extent than applying. Artificial intelligence will probably reverse this ratio, because you would have data banks, you would have literature banks memorizing and gulping in all the data and giving you the information as and when you prompt it to give you. Education is not going to be about learning and memorizing and then reproducing that. It is going to be about applying that. So, a lot part of our cognition, of our thoughts, of our mind, which has been previously occupied in learning and memorizing, most of the time without understanding, that becomes a major part of learning as well. People just mug it up without understanding. I think that whole thought has to change into understanding and applying, and not spending on learning and just memorizing certain things. So this is perhaps a thought much ahead of time, but we would really want to see the use of artificial intelligence there maybe someday, uh, probably to the use of its potential. Maybe we would need artificial general intelligence as well for that. But that's much ahead of time. Let's come back to our real time now. And Ashlesha, tell us, we have fantastic epidemiological studies happening in our country, and we have very good health policies. We have fantastic policymakers across the board in the government as well. And some fantastic policies have been laid down earlier in terms of communicable, non-communicable diseases. So how do you see a change or a shift happening in these epidemiological studies if we apply artificial intelligence to it? And will it bring a change in the way health policy is governed or made? And could there be somewhere a lookout of providing in real time equitable healthcare for all that we all talk about?
Wow. So no discussion in healthcare is complete without, without touching or without bringing it to health for all. So, AI or digital health or all these interventions that we are looking at, the ultimate goal is health for all, or, universal health. So all our policies, all our effort is towards that. Now, when it comes to artificial intelligence, what are we doing so that we have, these uh, socio-demographic gaps or determinants, which are very prominent in our country or in our society. We have AI tools now which can identify very well the high risk populations, using the predictive models. And we also have a fair amount of data now which can govern or which can drive the newer health policies. And the third one would be, monitoring of the health disparities through the tracking process. So now there are interventions like ABHA. There is ABHA card, which is linked to labs as well as healthcare facilities.
Right.
And the information is available with the patient or with the individual. Now, with those kind of interventions, we have that kind of power now, where we have we have linked the outcomes of individual and in real time, and what we call line listing. It is not just the numbers. These many, we always have talked about these numbers in the past. These many people, and even today we talk about it, these many Aadhaar cards were generated or these many health accounts were created. But then it's not only that. In the background is a whole process which is laid down, and we actually are monitoring now the real time progress of an individual, of a patient, right from when he's stepping into an OPD to avoid the queues at the OPD or in the hospital, to go to the IPD where he's interacting with the with the physician, and the physician is more aware. And all these things are happening just because we have this kind of artificial intelligence which is now being set up. And not just this, the we really are proud of our community health workers, who are the eyes, ears and hands of our healthcare systems in the rural areas and let's say far to reach areas. Now, with the help of AI, we have chatbots, we have training modules which can be easily sent to them, which can be easily understood by them in their languages, like I mentioned. And that again improves the healthcare delivery, right? The outcomes of the epidemiological studies, ultimately the epidemiological studies are done on the population, or the population, they are the population studies. So somewhere making the population aware or health literate, we require more awareness. And AI is one of the best tools that we have had till date, where maximum population in diverse situations can be reached fastest. So that way, let's say AI is helping us a lot. And of course, the next thing would be the policy decision support, or where AI informed policy development is happening now. There are, of course, we talked about predictive models, or evaluate, evaluating the existing programs. AI is one of the most effective tools where we can actually evaluate without the biases, personal biases, the existing healthcare programs and their outcomes, which is extremely important because we have had a robust healthcare, system, three-tier system that we talk about, and we have had committees work right from the independent, I mean, right from 1950s. But how much of it is required, how much of it is required to change, so all these things, so evaluating these programs, AI is one of the most important unbiased tool that we can see. And of course, AI models can definitely be utilized to uh, uh, appropriate the resources which are available. We are resource constrained, let's say. And then resource allocation can be one of the most important things where AI is helping us. um, uh, we will come later maybe to the epidemiological study and research, especially research, where AI is helping, and where ICMR now is using AI in a big way. So maybe we will come in a bit on that.
Yeah.
Right now, maybe policy is where AI is one of the most important support, is what I can say. Yeah.
So real-time decision making from the ground zero results,
Yes.
validated kind of results coming in, no spuriosity in that, real-time results coming in, and then based on that, you're making healthcare policy. So that is, I think, something that will really improve with AI. And we are using a lot of tech in public engagement and health communication. So I
Yes.
think that is a big space, and that will also be seeing a lot of development. I agree with you when you say that yes, epidemiological studies will require time, because again, from the limitation factor of good structured, diverse data set and getting more and more data, as Dr. Kulkarni calls data being the fuel for artificial intelligence. So I think that's going to take time, but we are heading in the right direction. And health for all, yes, that's the ultimate goal. But let's see how far we go, and we are really going to be watching that space. So back to Dr. Shelley, and this is a very simple question, and I'm sure you get this question from many of your colleagues. So how do you see radiologists adapting to this change, to this new use of teleradiology, AI in radiology? Of course, some may feel threatened, some may not, some may adopt it. There is a mixed reaction always. But how do you see this change happening? And if there are certain barriers, how do you see overcoming these barriers and adopt the technology, adopt the AI for a greater good?
So, Amit, as Dr. Atul rightly said, radiology and radiologists have always been a computer-based branch. I
Yes.
don't see a lot of resistance coming from radiologists in adapting AI. We are all well versed with PACS and we are working with it, whether you want it or you don't want it, you have to, adapt to technology. So, radiologists per se are not resistant to technology and to AI, but there is a lot of resistance from the authorities who
Okay.
actually have to chip in the money and who actually have to get the correct, AI tools, procure the AI tools. And also there are issues with integration where whether the particular tool you'll be able to integrate in your system or not. So technology has to be at par, in integrating these tools. And also there may be challenges from the other staff. who are dealing with it, right? The rest of the staff, the paramedics or the staff who is handling the bookings and all. From there, I do see a challenge, but from radiologist side, I don't see that anyone would, have difficulty in adapting to AI. Rather, we are very open because it's actually going to decrease and simplify our workflow.
So right. And I really liked one very important point that you made is the right kind of investment, and sometimes convincing the administrators of the hospitals or of an institution on the right kind of technology investment is also sometimes taken up as a barrier. So I think this brings us to a thought also that we keep discussing with our counterparts in the Western world, that there is always a need of a chief intelligence officer, somebody who understands both the side of the spectrum and that can actually help you equitably distribute your wealth towards the right kind of technology, because technology is going to be expensive, but you need to understand that what technological investments you need to invest on so that you get results. Now,
So
not all investments. Yeah.
Sorry, I would like to make a point here, Amit. Say if you are dealing with the investment in your department, or I'm dealing with it in my department, I think we working closely with the authorities and also from the industry side, if there is someone who understands actually the
Yes.
need base, actually
Correct.
the need of the radiologist or need of the diabetologist, and comes up with a solution, that is very important. What's happening is that there is a knowledge gap. Our
Yes.
demand is something else, the supply is something else.
Very
The
true.
chief intelligence officer or technology officer who's ready to spend the money doesn't understand either of us. So there is a lot of gap, and we as doctors need to put our viewpoint not only to our hospital staff but also to these industry people to take us on board and decrease this gap between understanding what you're selling actually, whether it's of use also or not.
Absolutely. I think it's a very important point you made there, and that often becomes another barrier. And this is a part that, again, the collaboration will become the key amongst the industry heads and the medical heads. Thank you, Shelley, for that insight. Atul, this is going to be the last question to the panel, and then we'll take a quick one-liner from each of you before we finish. But a very important question to you. You're a person that always wants to end with a lot of positives and a high note. So, what's the next big bang that is coming in the field of pathology? Are we seeing any emerging technologies, some innovations that is going to probably change everything?
Yeah, actually, I'm reading many of the good research articles which have proven very good things just for seeing. So earlier we were talking about we are seeing a pattern which are not even visible to the human eyes through microscope. So one of which is a correlation between a HND image and the molecular pattern of the image. Just for the example, if I look at a breast cancer slide, I don't know whether it is a BRCA1 positive or negative. But
Right.
AI is able to see that kind of pattern and is able to make some connections through it. And it is just an example. There are so many molecular activities in human body. And now even the medical, this oncopathology classification, it is going molecular since last 7 to 8 years. So there is a time for, now it is a time for precision medicine, and it is specific to one's personal human molecular structure also. So these kind of connection, if AI can predict, and right now it is too early to come into the market, but they are showing good result in research. So a lot of research needs to be done. Even in India also, we have so many good institutes which do a molecular workup on daily basis. They have a huge data. All they need is to think like this and broaden their vision to make this connection. So this will not only help us getting a precision diagnostic, but also it will help the setups which don't have that advanced level of knowledge. Or these setups. Just for example, I don't have molecular kind of workup in my institute. So if I get an assistance from AI, at least I can say, okay, go for these many markers, not just go for a whole NGS panel. So that is one of the things. Another one is ISCs. I'm sure all of us know about immunohistochemistry. For any cancer diagnosis in histopathology, one needs to confirm from ISC. So there is something called as virtual ISC. The good research is going on that also, that from H&E image. So just again to quote an example from breast cancer, if IDC breast cancer is diagnosed, what is the status of ER/PR and HER2/neu? Without knowing the status of ER/PR HER2/neu, any oncologist won't start the treatment. So now with the use of virtual ISC, AI can help us interpreting or getting us like a clue, like what would be the status of ER/PR HER2/neu just by looking at the H&E images. That is a very new kind of innovation, and it is called as GAN. If anyone is interested, that is Generative Adversarial Network. That is
Yes.
one of the subset of AI, and it is one of the most difficult subset. And it is like least commonly looked over because it is tough. And second thing is it is not getting that much hype as ChatGPT or that
Of course.
generative AI that is getting. GANs are not getting that much of hype.
So a lot of promises coming up from the fields of image analysis, from radiology, pathology, and we will be finding a lot of applications in the field of public health as well, especially in epidemiology, as we get more and more data, and probably medical education is going to change once and for all with the use of AI, as said by Dr. Kulkarni. So, folks, we are almost at the end of our podcast episode today. We had a diverse set of specialists giving their viewpoints and opinion. Before we let them all go, we're going to take a quick one-liner from each of them about their recommendations to their colleagues in their specialty on how to get going with AI. A specialty specific recommendation, not a general recommendation from each one of you. And then please also give a small comment about our Doctors AI Virtual Global Summit that is going to come up, and each of you will be leading a session. Dr. Ashlesha will be leading the session in public health. Atul will be leading the session in pathology. Dr. Shelley will be leading the session in radiology. Dr. Kulkarni will be leading the session in medical education. So give us a glimpse, a trailer glimpse as to what we can expect from those sessions in terms of content in that specialty. So we'll start with Dr. Kulkarni first.
Thank you, Amit. For all my physician friends, I will suggest them first to invest in AI, understand AI, practice it, and adopt to it. If they don't, they will be overtaken. As far as I won't call them as a replace, the patients will replace the doctors. And my views in our Doctors AI Summit, that we will take a cross section right from students to the deans and the vice chancellors of the university to understand what kind of change which they are going to face. जो देखा नहीं था, जो सोचा नहीं था, ऐसा कुछ तो होने वाला है. So they have to be prepared, and we have to sensitize them. We have to sensitize not only the younger generation, but even the middle age and the senior ones who are in their 60s and 70s to change their line of thinking, education, and even learning also. Thank you.
Fantastic, fantastic. Dr. Shelley?
So for my colleagues in radiology, as you rightly said, I mean, don't let AI replace you. We have to, we are the ones who have to choose the right AI solutions and validate it rather than AI validating the radiologists. And for the Global Summit, I would like to invite you all to this very interesting and very historical event, which is going to happen for the first time in India, where we would have AI updates from all the specialties. So as the wing leader for radiology, I can promise you a very interesting very interesting segment on radiology, where we would be having industry leaders, not only from India, but from abroad, from US and UK, who would be talking about various developments in the field of AI in radiology.
Fantastic.
Thank you.
Dr. Atul, your closing comments?
Yeah. So basically, to my colleagues in pathology, I would definitely like to comment, don't be afraid, because most of the people or most of the pathologists, they are the, I feel they are most afraid like they will be replaced. So I would say that don't be afraid and try to adopt or try to learn the basics. Soon you will get a hold of it. Yes, since we lack in the digitalization, it appears difficult in the beginning, but yes, it's like accept it or not, things are gonna change. So either you adapt to it or you will be on the bad side of it. I cannot put it in a very good sentence. And just for the summit, yeah, summit is a good chance to learn from basics and as well as what are the recent advances in pathology in with respect to AI. We are having sessions from not only from India but also from abroad. We are having a good faculties are out there who are working, who are like in real life they are working in pathology and in AI both, and one of whom you will get to know with time. She is also she would be the speaker and she is coding. She is also like working in pathology, and not only in pathology. She specializes in molecular pathology. So you will get to know like how if those people those people with hectic workflow, they can learn or they can adapt to the newer advances. So can you. So it won't be that much difficult. Ultimately, you will really like it.
So Atul has still kept his suspense. He's going to let it out once you register.
Yeah.
So, Dr. Ashlesha, what are we expecting from your session and comments to your colleagues?
Yes, so I would rather say that for my public health and community medicine colleagues who deal with enormous data, right, large data, let AI replace you. And, so that you are free to actually utilize that intelligence, the natural intelligence, to put the interpretation of interpretation given by AI in use to make the policies, to bring in that change, and rather than just grappling with large number and large data. So that's the kind of power that AI would give you in your hand. And we would be only at a disadvantage if we are not able to utilize that kind of giant sitting inside, or genie, let's say genie sitting inside the lamp. And for right from disease surveillance or outbreak detection to predictive modeling, or let's say risk factor analysis, or for that matter, vaccine development, and of course, research in various, fields. Everywhere, AI will do the hard toiling, where quality work, where, only human intelligence can bring that edge, would be for you, and you will be, more available for it. So I think it needs to be adapted or accepted in a big way in community medicine and public health. And of course, not to I mean, how many times can I mention healthcare awareness or health education? AI is the way to go ahead. Behavioral change analysis and so many other things, analysis of the programs or healthcare system evaluation, resource allocations, and so on and so forth. I say AI is going to come in, has been making its way, crawling in all of these areas. And for the summit that I can tell you, see, Yuval Harari, the author, right? In his words, let me tell you, he said, knowledge and information, nowadays it is available everywhere, right? And that is not the power anymore. You open your eyes and you have information, you also have knowledge, but then what gives you power is the clarity. So, with all the information overloaded around you regarding AI, and terms like deep learning or image or NLP and things like that, what all it means to you. I say, if we want to learn that really, so that it is put in my day-to-day use or your day-to-day, practice, this is the place or this is the time that you need to attend. So I think that is what our summit and especially public health session will bring to all of our viewers who will connect with us on that summit. So with that,
Fantastic.
I really thank.
Fantastic. We're going to be looking forward to that. And to all our folks who have not yet registered, today is still the last date till midnight Indian Standard Time. You can still register with the early bird discount. So you will be finding the link somewhere, maybe around in the MedSynapse platform or in the Doctors AI community. Please go back and register yourself. So before we end and we bring back Hetvi for the closing comments, Dr. Kulkarni has a breaking news to give to all our audience, and then we'll have Hetvi come in with the closing comments.
Yeah.
Yes, Dr. Kulkarni, what's breaking?
I just like to announce that there is a new robo, which is a combination of a chatbot and a robo. It is nicknamed as Petra. So it stands for pre-screening experience through robo assessment. It has been a commercial entry. It's a real life setting. It has been marketed by Merck. So what it does, it screens three diseases, diverse diseases: hypothyroidism, alcoholism, and pre-diabetes. And one of the comment which is there, that she has been deliberately designed to look, feel, and act more human. She has got a warm personality. It encourages people to share their information about their personal habits, health concerns, and gives some baseline advice also in an empathetic way. So this is something really exciting which I thought today, and I think that is what I wanted to share with all of you. And don't not to forget that it is a time for all of us also to register for the summit today at the concessional rate. Thank you. That's
Thank
all.
you. Thank you very much for the fantastic update. And once again, a big thanks to all my panelists today, Dr. Kulkarni, Dr. Atul, Dr. Shelley, Dr. S. Lesha, for joining in, sharing your viewpoints on your domain, on your specialty. Continue to be the voices of the Doctors AI community, the wing leaders, lead the way, and let's bring everyone together, because together, only together we can grow, we can learn, and we can adopt and we can adapt to the change that is happening around us. I think we can close the session. Thank you very much, and we will be back again in about another fortnight. And I think Deepu is going to be back with another guest, and we will be having another discussion on a subspecialty. So, to all our folks who've been there with us for the last 1.5 years on our podcast, thank you very much for joining us. Stay there, stay tuned, be hungry for this change that is happening, and let us keep on learning from each other. Thank you. Thank you very much. Good night. Good night, everyone. Bye.